Another assessment tool being radiography. All upper cervical techniques use radiographic analysis to guide them in correcting misalignments. The analysis allows for each individual patient to receive the most precise correction possible. Radiographs are taken in all three planes to get a three-dimensional measurement or direction and degree of misalignment for all orthogonal models and some articular models. Blair, however, takes a protracto view, which comes in at a diagonal almost through the eye to look at the opposite articulation between occiput and atlas, between the head and the neck. Blair also uses a stereolateral to look at facet alignments below atlas. X-rays are not performed on every visit. Research shows that misalignments are predictable in the direction that they re-misalign. So you don't need to take an X-ray to look at how the bones have misaligned on every visit because we know how they're going to misalign. Several factors are used to decrease X-ray exposure: aligning X-ray equipment, decreasing X-ray port size, meaning where the X-rays come out of the tube, specialized grids and filters, and shielding all decrease X-ray radiation. The safety and ethical dilemma of radiation exposures is an entirely different subject that we won't get into here. Suffice it to say that some believe X-rays should only be taken when trauma is suspected, not for just subluxation evaluation. Each technique has standards for taking radiographs. NUCA has gone as far as developing standards of care and practice guidelines that are continually updated regarding radiographic guidelines. And once again, all techniques, upper cervical techniques that take radiographs have guidelines on how to take proper films so that the analysis of the misalignment can be done correctly.
In your office, you take those post X-rays, and I think it's important that people understand that we do take X-rays, and they're very, very important if you're going to be putting even if it's a low, gentle force in the back of the neck here, it's important that someone looks into the spine. Do you want to talk about that a little bit, Kevin? Just how you do your X-ray procedures?
Well, it's just like you said, we take a pre, meaning before, and a post, meaning after X-ray to see what the alignment is before and what the alignment is after. And then when we have those X-rays after, it gives us more information on possibly changing the formula that we've created for that patient to get them even better of a correction.
I just want to touch on the radiographs. So X-ray imaging of the spine, how important that is, and that the safety of that actually is important for you to understand, because many people might be worried about an X-ray. And it's a baseline thing that upper cervical chiropractors, that is one of the things that denotes an upper cervical chiropractor, is they will do X-rays beforehand to measure rotation, misalignment, overlap, underlap, head tilt, all the factors of what is an upper cervical misalignment in the upper neck. And we will want to see changes in that over time. And if we don't have that X-ray, we can't do our job. And to get the benefit of upper cervical chiropractic care, it far, far, far outweighs any risk of an X-ray ever. The benefit of having a brain-to-body connection far, far, far outweighs the risk of X-ray. And when we talk about risk with X-rays, I mean, that's a whole nother video. We can go into that another day, but a lot of these fear ideas are based around the idea of a linear non-threshold hypothesis, which in reality hasn't been supported by the data that comes out of things like Hiroshima, Nagasaki, Chernobyl, things like that. The radiation risk at very low levels that we're taking with X-rays at possibly 10 to 20 to 30 microsieverts, which is basically like 2 days of background radiation, maybe 3 days of background radiation with an X-ray. And then if you stack on top of it a couple of them, you might be talking up to 5 to 10 days of background radiation. Normal radiation that you're getting all the time, it's coming down from the stars, the sun, coming up from the ground, radon in the ground. You get that all the time. So just to understand that it is very safe, we're working within a level of dose that is very low, far under the ever reported risk of any adverse problems, cancer, leukemias, things like that. Very, very, very low amount of radiation. So I just wanted to cover that because it's important that people understand when you go to an upper cervical chiropractor, they need to take x-rays. That's part of the deal. And it's safe. It's very safe.
Yeah, I used the analogy back about, I want to say 6 or 7 years ago. I figured it out with a colleague. We looked at the World Health Organization's maximum dose radiation recommendations for a year, and we took those, millisieverts or what, I can't remember exactly what those were, and then we looked at the exposure that we're doing as far as from a NUCA standpoint, pre and post x-rays, and we said, okay, well, how many of those x-rays could we take before we hit that maximum?
Right.
And we could literally do those x-rays for a patient every single day of the year and not reach the maximum threshold, which is, I mean, that's significantly saying how small the radiation dosage is for the x-rays that we're doing. So that's important to understand. And I can't quote what that is. Maybe when we do a future video, we can go with that and we can break down the numbers and express that. But again, even if there is some quote unquote danger to those x-rays, to have that brain body connection and not have a misalignment in your spine and be specifically adjusted far outweighs, of course, in my opinion, who I've lived through. I've lived through the pain and the suffering from that misalignment. I would much rather have a misaligned spine than a tiny dose of radiation. So.
Right.
Yeah. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support.